We will be giving him an intra-articular shoulder injection. The bony landmarks need to be delineated first. The first landmark is to start from the clavicle and reach the acromion process and the AC joint. Then the second point landmark that you have to identify is the coracoid process, which is the bony prominence just medial and down to the acromioclavicular joint. Then going laterally, you feel the acromioclavicular joint and try to find out the border of the acromion process. So for the posterior approach of the shoulder joint for intra-articular injection, you just have to feel for the soft spot that is seen across the medial or lateral border, across the lateral border of the acromion process. Come down 2 centimeters, approximately 2 finger breadths down, medially 2 centimeters down, and this has to be your entry point. Your direction of your injection needle usually is infiltrated and goes towards the subacromial joint. It doesn't have to go directly 90 degree, it has to go just beneath the subacromial joint. Now we'll be doing a small sterilization by applying a gauze piece with spirit over it. We'll have to move it round ways and then do it outwards. Now this is for the posterior approach for an intra-articular injection in the periarthritic shoulder. The cocktail that we use is usually depomedrol. Some people have also been using Canacort, that is 40 milligram. We use 1 ml of Canacort and approximately 1 to 2 ml of lignocaine, 2% injection. It has to be used in a sterile technique, loaded in the injection, and then has to be given. The landmark is again come down medially, again down, and then try to direct it towards the upside. We'll be giving you an injection. Just 2 minutes, sir. So this gives you a direct access to the posterior aspect of the joint, and you can feel a loss of resistance. Now you have to always aspirate to see that there is no blood coming into it. Once the blood is not there, you will be able to give it slowly and you will feel no resistance. So your flow of the injection should be free without any resistance. So we approximately infiltrate 2 to 3 ml of Lox and Canacort into it. Once it is done, you can see this back coming. This shows that it is free of resistance, and then again you can aspirate to see that there is no blood coming out of it. When this is done, you can take it off and put a small gauze piece